My topic of today is lower body fat depositions. Hello, I'm Dr. Sheetal Londhe. I'm a board certified plastic surgeon. I'm practicing at ZeroSize, Viman Nagar Pune. What is this lower body fat depositions? When specific areas in the lower body gets fat to be accumulated there. For example, it is just around the belly button. One. Second, it is just the lower belt area on the back side. Third, it is around the hip, that is the saddle bag. Fourth, just below the buttock, that is the banana rolls. Or the thighs themselves are very heavy. Okay, those are called the thunder thighs. So this is the area where fat can get deposited, which may cause problems later. There can be patients who may have a very lean body and only deposition of fat in this one area. Like you see a female, she's very nice in figure and only saddle bags are there. Or you see they've got very nice lean bodies and only the banana rolls are there. So this is one type of a patient. Some patients are like below the belly button, they're totally very heavy. Like they also have fat around the belly button, then the lower pouch of the tummy, fat lower back, fat around the buttock, below the buttocks and the thighs and the saddle bag. So this is what is called as lower body fat deposition. So is it because of your lifestyle? No, it's not because of your lifestyle. Because you're eating too many calories, you're not exercising. No, it's not because of that. This is a condition called as lipodystrophy. That means fat is abnormally growing in one area. It has no reason why it is growing there. It's seen basically in genetics, like it's hereditary. It happens with families. So it's not only females will have lipodystrophy. Males and females equally have this type of a lipodystrophy. If you see males who have lipodystrophy in the lower part, below the belly, they have a lot of fat deposition, or they have, the lower belt area, the backside. If there is fat deposition and they, instead of a V shape, they have got the inverted bracket shapes, they also have gynecomastia along with this, because this is deposition because of hormonal imbalances. So we have to rule out all these things. But does ruling out this lead us to something different? No. The final treatment is the same for each and every patient. So what is that treatment? So that treatment is VASER liposuction. Why VASER liposuction? See, this is a single body part that has got deposition of fat that is too much. So VASER is going to take care and dissolve the whole fat, emulsify it completely and remove it. One. Second thing, because this is in an abnormal area where the skin has stretched too much as compared to the rest of the skin in the body. So VASER will also call contraction of the skin and you will get a good contoured body. So yes, for lipodystrophy of the lower body, VASER liposuction is the treatment of choice according to me. So what else is required in this? One thing, evaluation of the patient. Once the patient is evaluated, which body part, what amount of fat and all is calculated to be removed. Then comes your blood test. Then comes test like 2D echo if required, and very important to take care of the veins of the lower body, because when we are doing so much of liposuction, we have to take care that the patient doesn't land up into DVT or something. We also do a 2D echo of these patients. Then comes my physician who gives the physician fitness, then the PAC from my anesthetist, and then the date of procedure has been given. Lipodystrophy treated with VASER liposuction, there is no major scars that happen, only minute, pinpoint scars from where my trocars are going to go in, and that's the only thing that the scar happens. After the procedure, the recovery is very fast because it is VASER liposuction. So pain, if you compare to conventional liposuction, is literally down by more than 50%. Skin is already contracting and the fat is emulsified, so you get an even result. There are no bumps and lumps or anything that will be seen in your results. You have to wear a pressure garment after that for a complete period of 3 months, and you start walking immediately the next day of the procedure. Yes, your regular activities are started totally after the procedure, but gymming, swimming and all those heavy activities, we will advise you to take a gap of at least 3 weeks to 1 month before you start doing all this. So this is all that I could tell you about lipodystrophy, that is fat deposition in the lower body part. If you have any queries, you want to know whether is this the lipodystrophy that is there which I have, or is there something called different, or can this be treated by VASER liposuction? Am I the right candidate? All the questions and confusion which is there with you, I am here to answer. So please visit us at ZeroSize, Viman Nagar Pune.